1. Twist off the top of the buffer bottle. Slowly dispense all of the buffer into the extraction tube. 2. Insert the swab into both nostrils of the patient. The swab tip should be inserted up to 1 inch from the edge of the nostril. Roll the swab 5 times along the mucosa inside the nostril to ensure that both mucus and cells are collected. 3. Insert the swab into the tube and plunge the swab up and down in the fluid for a minimum of 20 seconds. Then hold the swab against the bottom of the tube and roll 5 turns. Remove the swab. Press the nozzle cap firmly onto the extraction tube and place the tube in a rack in the designated area of the workspace. 4. Tear off the foil pouch. Take out the test strip cassette and place the test kit on a clean and level surface. Gently squeeze the rigid body of the tube, dispensing 3 drops of the processed specimen into the sample well. 5. Read the test results between 15 and 20 minutes.